Welcome to our Thursday educational webinar on the basics of Medicare. Everything you need to know explained in the simplest terms possible. My name is John. I'm president of Riley & Associates. We are a local independent insurance agency specializing exclusively in Medicare with over 2 decades of health insurance experience. Our goal is to keep things real simple. We're going to cover the basics of Medicare. We're going to cover your 2 options and our services. Today, I'm going to take you through much of what we go through with our clients during the personalized presentation following our discovery call. With our clients, we go into the specific recommendations and costs based on their needs assessment. However, this presentation will keep it, generic, of course, but we'll give you a good idea of what those options look like and the general cost for those options. So Medicare has a lot of details, rules, and deadlines. So we're going to be covering quite a bit today in hopes to answer as many of your questions as possible. So what is Medicare? So Medicare is health insurance provided by the federal government for those 65 and older and those under 65 with certain disabilities. Now, most people are eligible for Medicare Part A and Part B if they are 65 and either they or a spouse has paid into the program for 10 years or 40 quarters. So Medicare has 4 parts. We're going to begin with Part A and Part B, also known as Original Medicare. Everyone starts with Part A and Part B. So you either enroll 2 to 3 months prior to your 65th birthday or later when you retire and come off your large group employer plan. Just a note there, if you're on a small group plan under 20 employees, then you have to enroll at age 65. A lot of people don't realize that. So you have to be in a large group plan if you're going to delay Medicare Part B. So just note that. So let's go over this. Part A is your hospital insurance. This covers inpatient stays, skilled nursing, and Part B is your medical insurance. This covers everything like doctor visits, labs, x-rays, diagnostics, and even outpatient services. Now, Part A is free for most people, but Part B comes with a premium. For many people, the premium is $202.90 in 2026, but it is adjusted up for higher income earners. So we'll look at a chart here on one of our slides coming up. Okay. So now that you know about Original Medicare, Part A and Part B, let's kind of put this together. So Medicare has 4 parts. Part A and Part B is your core health insurance covering both facility and medical services. Now, Part C, also known as a Medicare Advantage plan, is an alternative way to receive your benefits and works much like an HMO. Part D helps cover your prescription drugs. So as you will see, you only have 2 options. Either you're going to stay with Original Medicare here, Part A and Part B, and add a Part D prescription drug plan and a supplemental plan, which will fill in the gaps, which we'll talk about here in a minute. Or you'll go ahead and enroll in an Advantage plan. Okay, so those are your 2 options, and your Advantage plan includes your prescription drugs. Okay, so those are your 2 options. They're very similar to your individual or employer plan that you have now, because right now you're either with a PPO type plan, which is going to operate more like Original Medicare, or you're with an HMO plan, which is going to operate more like a Part C or an Advantage plan. Okay, but the good news is either way, the benefits are a lot better with Medicare. So that's the good news. I mean, there's a lot of good news. We'll go over it, but that's really good news. So before we go any further, I strongly suggest that you set up a discovery call 3 months prior to the month you turn 65, or when you're planning to retire or move off your large group employer plan and sign up for Part B. So why is that important? You don't want to miss a step or a deadline. Okay, so during this call, during the discovery call here, we'll determine your timelines, we'll compare coverage, create a schedule based on your needs, and begin preparing a presentation and options for you. Okay, so basically what we do is we set your path, we guide you through the process and get you enrolled on time in a plan that's right for you. Okay. Also, for employers, just on a side note, if we have employers and partners that might be viewing today, just to know, we suggest a planning meeting at age 62, as income and other events could affect Part B premiums at age 65 or later when they plan to retire. So it's a good idea to have this planning meeting if you can, because you can make adjustments if you like, or put in, have a strategy to maybe reduce your income when you plan to sign up for Part B. But we have a planning checklist and video link that better explains. So just click the form link below and we'll send that out to you. Okay, so let's now move on. We're going to take a look at your initial enrollment periods and other election windows. Now, this is really important stuff. There are three main enrollment periods that you need to understand at this point, and then a couple which I'll just tell you about. Okay. The first one is the initial enrollment period here. Okay. In your initial enrollment period, this is a time when you're going to sign up for Part A and Part B of Original Medicare. Okay. And we also do what's called a pre-enrollment presentation, where you choose the additional coverage to pay for the out-of-pocket expenses if you're working with us, where we look at what option 1 and option 2 are. But both will typically begin on the same day, the first day of your birthday month. So when you sign up for Original Medicare here, you've got 3 months prior to your birthday month, the month of your birthday, and 3 months after your birthday. Ideally, you should sign up 2 to 3 months before your birthday, and then your Medicare will go effective on the first day of the month you turn 65. And just note, if your birthday actually falls on the first day of the month, then Part B effective date will be a month earlier. So say, for example, your birthday was on April 1st, no fooling there, but if it was on April 1st, your Part B effective date, if you signed up here for Part A and Part B, your Original Medicare, or just Part B, your effective date would not be April 1, it would actually be March 1. So just so you know, if you're working with us, we're aware of that. We set that up on the schedule and help you with that. Okay. So additionally, if you're receiving Social Security retirement income benefits prior to turning 65, Social Security, easy for me to say, will automatically enroll you in Original Medicare, usually 3 months before your birthday, and your cards will arrive a few weeks prior to your effective date, the first day of your birthday month. So everyone else, though, has to sign up online for Original Medicare. Okay, we'll help you with that. We've got an email, we've got a system and email for everything because there are so many details. We don't want to miss anything. So we have an email that walks you right through that, and we set up a whole schedule for you as far as timelines and that sort of thing. The next enrollment period that you want to be aware of is called the supplemental, or also known as Medigap, which is over here. Okay, and so this open enrollment period begins when Part B goes effective and provides a 6-month window to enroll in a supplemental plan where you cannot be denied for health reasons. So a supplemental, also known as a Medigap, will fill in the gaps if staying with Original Medicare, which we'll discuss here more in a few slides. Okay, the next enrollment period that you want to understand is the annual enrollment period. Okay, and this period runs from October 15th through December 7th, and this is for everyone. And it's just it's a time where we review the plan options with our clients. Time you'll take a look, and if you've made adjustments throughout the year and you change doctors or medications, you just want to always make sure that those things are going to be covered going into the new year, right? You don't want to have a surprise and all of a sudden realize, oh, something that, doctor or medication that was covered is no longer covered in the new year. So that's why during this annual enrollment period, and we have a process for this, we start out, I think, actually in August with, a campaign letting our clients know, hey, it's that time of year. We have a secure link, so you just update all that stuff. We make it really simple so you don't miss anything. But that's really important. And so the other two enrollment periods just to know about is the open enrollment period. And the open enrollment period is for those that are already on a Medicare Advantage Part C plan. And so say, for example, you missed your annual enrollment period, or you went through it, but then all of a sudden you didn't realize, hey, a medication did change, or a doctor did change, or something changed. And so you actually had the first 3 months, January, February, March of the new year, to make a change where you can move between Advantage plans. So you can go from one that doesn't cover your doctor or medication to one that does. Or you could actually disenroll and go back to original Medicare, which we can certainly help you with all those details and get you enrolled. But that's something to be aware of as well. So it's kind of like a safety net for those that are on Advantage plans. And then the last one, hopefully you don't see that day, is called the general enrollment period. And the general enrollment period is for everyone that missed their initial enrollment period. And generally, they're going to have a gap in coverage, and they're going to usually pay a lifelong penalty to Social Security, Medicare for life. So you definitely, that's another reason why you want to set up a discovery call, 3 months. If you're not a planner, do it. If you are a planner, you'll be contacting us 6 months prior, like some of our clients. Okay. Let's go ahead and take a look. Let's look at original Medicare Part A and Part B. And as you can see here, there's going to be some out-of-pocket expenses and there's no out-of-pocket maximum. So let's take a look at how we get those things covered and what those things are. So first, what are those costs? So original Medicare, these are your out-of-pocket costs for original Medicare, which you're responsible for. That's why you select either a Medigap plan, a supplemental, to pay for those, or an Advantage plan that will also cover those out-of-pocket costs. So both Part A and Part B have deductibles, they have co-insurance risk, plus no out-of-pocket maximum. So that's why you get either a supplemental or an Advantage plan to cover those costs. And I hope that makes sense. I mean, you can stay with original Medicare, but you've got a lot of expenses and risks there that is not covered. So we don't recommend it. Okay. At the beginning of the presentation, I mentioned that most people will pay $202.90 in 2026 for their Part B premium, because there's no premium for Part A. It's free for most people, 90-some%. But you do have a Part B premium, and it starts off at $202.90, but it's based on your income, so they can adjust it up. So this is the chart. So it's called the IRMA chart, or income related monthly adjustment amount. Okay, so if you're in a higher bracket, either individually or filing jointly, then they can charge you, and they will charge you. I shouldn't say they could, they will charge you a higher premium. Okay, so when you sign up for original Medicare Part B, you're going to get this bill for $202, if you're here, $202.90, but they're going to send it to you for the first 3 months. And that's something else to be aware of, is that when you sign up for original Medicare Part A and Part B, your first bill is going to be for 3 months. So it's not going to be $202.90, it's going to be $609 and change. Okay, just so you know that. And then if you did trigger IRMA, and they're going to look at your tax return from 2 years prior. That's how they determine it, because most people have filed, they haven't filed an extension, right? So they can go back 2 years, determine what your adjusted gross income is, and that's how they base this. This is how they figure that out. Okay. But if you did trigger this, then what they will do is they will generally you'll get that first bill, and then you'll get an adjusted bill after that for the extra IRMA charge. And then just so you know, once you pay that first quarterly bill, then you can sign up, and we've got an email, and we suggest that, and we help you with all those things. But you want to sign up for Easy Pay, and then that will go ahead and deduct it monthly from your account. Okay, so just so you know, and the other thing too is that if you do trigger IRMA, and you think, and your most recent tax return puts you into a lower bracket, then you can let us know. You can file an extension, and that's available online through Medicare.gov. But we have an email for that. The attachments, we can walk you through that. But if you are in the lower, you definitely want to file that appeal. They'll go ahead and review that, and then hopefully adjust that down for you. Okay, and then also, just so you know, if you do trigger here your Part B for a higher income, you're also going to have a little bit higher Part D premium that they're going to add to this number. So we'll look at that chart here in just a little bit. Okay. So up to this point, we've addressed the parts of Medicare, the timelines for signing up, and then the associated costs. So now what we're going to do is we're going to look at your two options for filling in the gaps and paying for the services that are not covered for original Medicare. So this is where we're going to kind of go into detail on the two options. But before that, what I want to do is just look at your two coverage options, and I want you to just kind of understand better how this applies to what you have now. So original Medicare has, you've got your original Medicare Part A and Part B. Right now, you either have a PPO or an HMO. Sorry, that wasn't a smooth transition. You either have a PPO or an HMO now. So whether it's through an individual plan or through an employer, okay. But a PPO plan here, usually you have a little higher premium and out-of-pocket cost, but there's a lot more freedom with a PPO, and that's probably why you selected it. There's a much larger network and less rules. With an HMO, generally you have lower premiums and out-of-pocket costs. However, there's less freedom. You've got a smaller network. It's usually tied to a community-based, hospital and care system, and you usually have to get prior authorizations and referrals. So it's got those requirements, but that's how an HMO works. Okay. So that said, both come with prescription drug coverage. So whether you're on a PPO now with your commercial plan or an HMO, they come with the drug plan built into it. So again, you currently have a PPO or an HMO. And when you go to original Medicare, you basically have those same two options. However, the Part D is not built into that. So it would be with an Advantage plan, but not with a supplemental. And so we'll take a look at that so you better understand that. Okay, so now what we're going to do is we're going to look at the PPO kind of model, which is original Medicare. So everyone must get original Medicare Part A and Part B and cover those out-of-pocket costs. And we'll do that through a supplemental and a Part D plan. So option one, I call it like a PPO model, which is here. You have original Medicare, and then you get a supplemental to pay for the deductibles and out-of-pocket costs, and your Part D drug plan. Okay. The other option is your HMO. This is option two, where they cover Part A and Part B, and they include a prescription drug plan. So both are excellent options. And so what we're going to do now is look at option one, which is original Medicare with a supplemental plan. So we'll look at that first. And that has no networks and allows you to see any doctor, any hospital throughout the nation that takes Medicare, and the insurance does not get involved in any decisions. So if you're with a PPO and you want to keep that freedom, you're going to love option one, which is adding a supplemental in Part D. So let's go ahead and jump into that, and then we'll cover option two here in a few slides. Okay. So when you go with original Medicare with a supplemental plan, you see your provider, you give them your Medicare card plus your supplemental card. They don't bill you. They bill Medicare. Medicare goes ahead and pays their portion and then sends a balance bill onto the supplemental or Medigap plan. Okay, so your supplemental company, if you're on original Medicare and you add a supplemental and you add the Part D and you stay with that model, then you're only going to pay the 283 Part B premium. That's going to be your only cost for the health insurance side of things, not including the drug plan. And so that 283 is the Part B deductible. That's your only cost on your Medigap plan, on your supplemental with original Medicare. And you're going to pay through that at the beginning of the year. So whether you get a doctor visit or labs or x-rays, you're going to pay through that 283. But then after that, you're done. So that's the good news. So it really gives you total freedom and very inexpensive. You really look at it, it's like maybe a $300 out of pocket, right? Something like that, $283. These are the things that the supplemental will cover that original Medicare does not cover. So everything gets covered and you're made whole. Now let's take a look at option two. Option two is more like your HMO model. It's also known as an Advantage plan or Part C. So with choosing a Medicare Advantage plan, it's a second way to receive your benefits, and they're covered by a private insurance company, just like a supplemental would be. But here you would be covered by a private insurance company. And what they would do is they would cover Part A, Part B, and then they also include the prescription drug plan as well. So this plan works just like an HMO. It includes your prescription drugs and extra benefits, which we'll discuss here at the end. But like any HMO, you've got a primary care physician who directs your care, and so you have to get referrals and prior authorizations. But one thing to know, at least here in California, I mean, we've got one of the best HMO networks in the country. I mean, you've got, Cedars, UCLA, PIH, Providence, Torrance. I mean, I could go on and on. So you really have great options if you do want to go with an HMO. So let's go ahead and we'll take a look a little bit more. So again, when you go with an Advantage or Part C, the HMO model, it's going to cover Part A, Part B, and your prescription drugs. And it's also going to cover some extra benefits like dental, vision, hearing, and then gym membership. And some of the supplementals give you gym membership, but most of them are not going to give you a dental plan, a vision plan, a hearing plan, things like that. So there's some extra benefits that really make it desirable. So if you like an HMO, you're going to love an Advantage plan. Okay. So these are your two options. So option one is kind of your freedom option. That's your PPO. You're going to stay with original Medicare. You're going to add a supplemental and a prescription drug plan. Option two is like your HMO model, Advantage plan, Part C. And that's going to include a Part A, Part B, and Part D. And it also includes extra benefits as well. Okay. And most of the plans here in Southern California have a very low out-of-pocket on Advantage plans, anywhere from $300 to $999. Most of them are around $300 to $500 now here in Southern California. So it's about the same as the supplemental. So you've got really kind of the same out-of-pocket cost. Your Medicare Advantage does include prescription drugs, but they work the same once you've got the plan. And so let's take a look at that just so you understand that it doesn't work much different than what you're used to, meaning that the prescription drug plan that you have built into your either your PPO or HMO plan that you've had in the past, either through your employer or individually, it works just the same, meaning that you've got co-pays for different tier levels. So here you have tier 1, which is preferred generic, and on Medicare, it's either whether you have a standalone Part D with your supplemental or it's built into your Advantage plan. It works just the same. So we're talking one in the same plan. It's just one's included and one's separate with the two options, right? Okay, so the first one, if you're with a preferred generic, generally you're not going to pay any premium. Generally, most of those are zero copay. With generic, that means it's a generic, but it's not with maybe a preferred pharmacy, and so you might have a small copay there. These are a little bit higher than most, but I think that's a national. And then preferred is, your brand. Then your non-formulary brand, you're going to pay a copay or a percentage. And that's how it works. In 2026, your maximum out of pocket is $2,100. And you do have a deductible on some of these plans. With your Advantage plans, with the ones that are built in, some of them don't have deductibles. Some have, partial deductibles. And then with your regular Part D, you do have a full deductible for your brand name and non-formulary brand. Okay, just so something to know. But you've got a $2,100 out-of-pocket maximum. So if you've got a really expensive drug that you're paying for, you'll be stopped out at that number. Okay. So this is just a kind of a different way to look at it. You're blue here. Most plans in the deductible phase, and that's usually going to be for tiers 3, 4, and 5 for your brands, non-formularies and such. You're going to pay through that deductible, and then you're going to pay a copay or a percentage up to your out-of-pocket maximum of $2,100. Now, keep in mind, if you're not taking medications, then you're not going to have any costs in here, right? Or the other thing to keep in mind is that if you're on a plan during the year and you get a new medication, if it's not covered under the plan, under their formulary or non-formulary, then you'll want to reach out to us and we'll see if we can get you a coupon or find it through a different provider at a discount until the annual enrollment period, when we can go ahead and search the plans again, make an adjustment for you and get you re-enrolled for the new year. Just a couple of things to know. So here is your Part D IRMA chart. Remember I mentioned on Part B, if you trigger IRMA and you're paying a higher premium to Social Security, then you're also going to trigger it here as well. So if you're in Category 1 based on a joint or individual filing and you're paying a higher amount for Part B, you're also going to pay an additional $14.50, which is going to be added to your monthly premium. Okay, so just something to know. Let's see, is there anything else on here that I need you to know? I think that's about it. Okay. Then let's take a look at our services. We'll kind of run through that. So why do you need an insurance agent or team that specializes in Medicare? There's a lot of reasons, but it's confusing. There's a lot of, deadlines, a lot of information. That's why we've got a full-blown system with all the steps to make sure we don't miss anything for clients. So we get you on a schedule, we educate you, we keep you informed throughout the year. We handle your annual review with you. We help you to make changes if you need to. We help you with medication changes. We offer, like I said, that secure link so you can easily update things and make changes, and it makes it easy for us to review it for you. And then we can also provide, assistance with provider networks and things like that. So we work hard for our money, and we're definitely a good value. So whether it's us or another agent, you definitely want to work with someone that has a system that can educate you and help you throughout the year. Okay. And just so you know, this is how we work with you. We have a simple process. We have a three-step process for onboarding new clients. So the first thing we do is we schedule a discovery call here, and that's kind of where we get the details. We better understand, your current plans and what your needs are. We collect your medications and physician information. We have a secure way to actually gather that ahead of time now too, which is super for everyone. And then we put together a presentation, which is here, your personalized review. And that's based on our discovery call. We put together a presentation where we educate you, kind of like what we're doing today, on the basics of Medicare. We take you through your options, which are based on your needs and what we discovered during your initial call. And then we get you enrolled. And then after that, usually about 3 weeks later, depending on your enrollment date, we go through what's called an orientation meeting. And this orientation meeting is just really important, I think. That's the time where what we do is we go through after you've received your welcome kit, we just kind of go through your benefits, make sure you understand how to access your benefits. We answer any questions you have because you will have questions, and then we also put together a PDF, which is something, all of this, we go way beyond, and we do this for all our clients, these presentations as well as the PDF. But the PDF just includes all your links to your plan, phone numbers, everything you need to know on one clickable document, and we send that out to you as well. So we try to we try and educate you up front, so you're really comfortable and you know how your plan works. And we find that when we educate you up front and we spend the time up front, things go much smoother. And again, do the pre-planning, the discovery call, that you just don't want to miss that. And then the last part here, as I mentioned, when we go through it with our clients, these are very specific prices, but I want you to get an idea here, just what that looks like. So when we go through the presentation, if you go with option one, you're going to be paying your Part B premium. And in this case, the par is 202.90. Then you're going to pay an additional, a supplemental cost. If you're going with original Medicare plus a supplemental, you're going to add 150 to 250, depending on your age when you come in. And then also a Part D, which can run anywhere from $0 for your premium or $200. It just depends on if you're taking a lot of medications and things like that, and whether they're expensive medications. But most of our clients, just so you're not freaked out about it, most of our clients are, paying $0 premium or $5, but we do have those that are paying in upwards of over $100, because they're paying, they take a lot of medications and some very expensive ones. So, but in general, your total cost is going to be anywhere from about 350 to 450 all in. Okay, meaning your Part B, if you're at the level one, plus your supplemental plus prescription drug. Okay, so that's going to be your cost if you go with the supplemental. And again, your only out-of-pocket cost there is going to be any copays you have for prescription drugs, and then your $283 Part B deductible. If you go with the Advantage plan, then it's gonna, which works like the HMO, you're going to be paying the 202.90 as well. Everyone pays that. And then for California, most of your plans are $0 premium. There are some with premiums, it just depends, but most of the plans are $0 premium, and it includes your drug plan and a lot of extra benefits. So that option usually looks around 200 and 290. So, basically it's double, really, if you're going with a supplemental plus a PDP. Okay. So hopefully that answered all your questions. Thanks for your patience too, as I get up to speed here on doing presentations. I'm really good one-on-one, but when I'm talking to a camera, it's quite a bit different. But anyway, I do appreciate your patience. I appreciate you joining us today. And if you want to reach out and schedule a call, you can give me a call here, extension 2, or you can send us partner, like an employer. We work with a lot of employers and advisors, financial advisors, and agencies and that sort of thing. You can go to RileyEBI.com and you can schedule a call there. We've got videos, resources, and then for individuals watching today, you can go to MedicareSouthBay.com, which is our landing page for Riley and Associates for individuals. And again, you can schedule a call with me there. There's some videos there, information, and we've tried to keep it really simple. So anyway, thanks again for joining us today. We really appreciate it, and wish you a great day and summer. Okay, thank you.